Good afternoon all. I'm Dr. Jalaja Ramesh, St. Isabel Hospital, a consultant diabetologist. Today I'm going to tell what are the tests to be done regularly for a diabetic person. Diabetes is a chronic progressive disorder. Once you're diabetic, you're always diabetic, especially type 2. When they come after 2 years, the diabetes reversible cannot be done. So based on that, diabetes is got another name called silent killer. So diabetes, if sugars are not kept under control, it can affect any part of your body. It can produce the diabetic retinopathy affecting the eyes, or diabetic neuropathy affecting the nerves. Diabetic kidney disease called, it can affect nephropathy. Diabetic kidney disease, it can affect the heart, producing cardiac problems like angina or attacks or ischemia, or even the cardiac dilatation can happen called heart failure. It can affect the brain also. From head to foot, any part it can affect. But this is everything generally happens if the sugars are kept under higher control. There's no use of just checking the fasting and PP sugar. We have to do other tests because sometimes the patient may not have any symptoms. Even heart attack also can come without any signs and symptoms also. How to override this problem? So apart from checking your sugars, you check HbA1c, this last 3 months average. If the HbA1c more than 8.5 and above, it tells the doctor and the patient to be more alert, do an intensive sugar control so that the complications and organ damage can be avoided or prevented. The next other test called lipid profile. We have to do total cholesterol, good cholesterol HDL, bad cholesterol LDL, and the non-HDL, the ratio. It helps the doctor and the patient to understand what is the cardiac status with the need for the statins, anti-lipid drugs. And good cholesterol is low, we can improve by regular walking and taking badam in the diet. And creatinine is a test to be done for all patients with diabetes on medications. It shows a kidney function test. Apart from the creatinine, you need to do urea if the age is more than 55 and above. So if we do this regularly, we'll be knowing there's something called EGFR, estimated glomerular filtration rate. Based on that, the dose of the medicine can be adjusted. And apart from not only checking sugars, all diabetic patients should regularly check the blood pressure. BP is also very, very important culprit in producing complication in a diabetic person. So yearly once at least an ECG is necessary. Yearly once you have to check the retina for retinopathy. Yearly once you have to have a foot examination. If we do this regular basis, we can prevent the complications, or you can detect the complication earlier so that you can live well with the diabetes.